from my work with payers, and most of my work in interoperability has been with big insurance companies in the States, and there is this blatant like misalignment of incentives, right, between different EMR companies. Payers, doctors want something completely different, and insurance companies have actually been paying health information exchanges and doctors to give them better data. But being an analyst on the other side of that data, a lot of the times you can't even tell which doctor wrote which lab, so you can't analyze it. And so, my next question is around, or my next picture is, bringing it back to healthcare. We all know these pairs. So, one of the biggest thing that, especially, the US has seen, and we're seeing more and more around the world, but it's like the digitalization through electronic medical records. And I assume those are a big part of your concern and work with Firely. We're hearing a lot of these medical records now that are the holders of our data, being open and implementing FHIR. And we're going to talk about what FHIR is exactly, but implementing interoperability or talking about it. But at the same time, we're hearing in the news the Epic CEO saying that they're not going to make data available, and then at the same time, we're seeing CMS come up with interoperability rules and doctors being kind of listed or shamed to if they're not sharing data. And it's a very sensitive issue, of course, because of privacy and stuff. But when it comes to these electronic medical records, what is the history there, and what are you seeing them do in terms of aligning on a single goal, kind of like the space mission? Are we getting close, or are we far?
Well, discussions about interoperability often become vendor bashing, right? And we all know these stories about the vendors sitting on their or your data, and it being very difficult to get to your data. I don't think you can say that the vendors are anti-interoperability per se. And if you look at the FHIR community and the people that we work with and the people who attend the HL7 working group meetings, where actually this whole idea of data exchange and opening up data silos is being made, this is where you find a lot of bright minds from the vendors, people who care about interoperability and care about collaborating in a non-competitive way. And you see that happening at Dev Days as well, with speakers from the different vendors who have a common goal. I know the stories about the Epic CEO as well, and they're famous, of course. But it differs per vendor, I guess. And what I see as a more persistent problem is that is who should be paying for interoperability. So the vendor, if you sell an EMR, an electronic medical record piece of software, as a vendor, you might argue that interoperability is a feature, and the customer should pay for the feature, right? Because that's the game. But on the other hand, the hospital might say, what good is this piece of software if I cannot get to my data? That's vendor lock-in, And you might even argue that the ultimate beneficiary of interoperability is, of course, the patient, right? So should the patient pay? So the whole problem is around who should pay for interoperability. And if you all have a problem, the same problem, then what happens, right? No one feels responsible for the problem. And I think that's a dilemma for interoperability. It's in between stakeholders, so no one feels responsible and no one's willing to pay for it. And I guess that's where the government steps in, like what's currently happening in the US with the 21st Century Cures Act, but also happening in different countries in Europe, where the government steps in and mandates interoperability. But for the government, it's not that easy either, because many governments have had, let's say, mixed experiences with interoperability in healthcare, where they've spent billions of dollars that ultimately went down the drain. So it's a difficult problem because it doesn't really belong to anyone. That's something that I see happening.
And do you see this happening in like certain countries better than others? So I hear about the experience in a lot of the Scandinavian countries, specifically Norway, with this. They have this EMR called DIPS, and essentially every Norwegian hospital is using DIPS, and so they have a de facto interoperability. Now that's not essentially how the capitalist system works, but it's a government-run EMR. That's the only company that does it, and we can argue whether capitalism works even in healthcare at large or not. But the fact is that they do have interoperability, but they don't have maybe like they don't have competition, and therefore their EMRs aren't necessarily as fancy as Cerner or Epic, but they can share data. So which one is more important at the end of the day? Is interoperability worth taking a little bit of innovation out of the products and making sure we share it? It's a difficult question, but do you have any thoughts on that?
Well, I don't think DIPS is a government-run business. It's a business, a commercial enterprise. If you look at the famous example, which was in the UK, where a project by the NHS to build such a government-run EMR, they failed miserably, and so it's building software is not something that the government is good at. So I wouldn't be a proponent of that scenario. And the funny thing is, Omar, when I speak to people, especially, by the way, the Americans, but also the Norwegians, it always seems like people think that it's better in another country, and people within 5 minutes they start complaining about their own healthcare system or their own health IT. It's always better elsewhere. And then when you talk to these people who are elsewhere, they have the same complaints. So if you talk to the Norwegians about their interoperability, you will hear a lot of stories of things that are going very, very slow. And that even between hospitals that have the same EMR, it's hard to achieve interoperability. That happens with different hospitals who have the same, for instance, Epic EMR. It's not that easy to exchange data if you've implemented the EMR differently. So,
yeah, absolutely. I heard you can have like thousands of implementations of Epic.
Yeah, correct. Yeah, so I'm not sure if that, and even if you could technically, the question is if you can do it functionally, because the workflows might be different, or there might be policies or security or privacy restrictions that are still barriers to data exchange. So I think it's well, it's not. I think the story is of proceeding slowly, but it's not a success story all the way, like in other industries, probably. But hey, maybe that's because I'm not in those industries. We don't see the struggle there.
Yeah. I guess the summary of this point is that the grass is always greener on the other side, right?